welcome everybody, and thanks for joining us. This is the second eCW podcast. My name is Aaron Ibrahimi from eClinicalWorks, and we're here with Dr. Michael Dominguez of HealthTexas Medical Group to talk a little bit about eClinicalMobile. So thank you for joining us. And Michael, why don't you tell us a little bit about yourself?
Well, I'm a family physician. I've been 17 years out of residency now. Grew up in southern New Mexico and went to school at UT Austin, medical school here in San Antonio. I've been with HealthTexas just now 4 years.
Okay. And how was the transition between your old practice, your old system, to eClinicalWorks over here at HealthTexas Medical Group?
Very smooth transition. I was the Chief Medical Informatics Officer for University Health System prior to joining HealthTexas.
Okay.
And so I went from using a competing EMR, primarily inpatient, to eClinicalWorks, and it was very smooth transition. The training was very easy to pick it up.
Good. Now, you were in a situation where you had obviously moved over from a previous hospital group where you were using another system. You came into eClinicalWorks, into HealthTexas Medical Group after the fact of their initial training. How was that transition? Did you have another trainer come out, or was it a champion user here at Texas Medical Group that kind of got you into your training and helped you learn the ropes?
We have a dedicated training department. Diana Leza is our trainer, and she spent a week with me going through eCW. Everything I knew at the time I learned from Diana. And that's true for all of our providers. They spend a week with our trainer. And we've since been able to expand our training department into a full-fledged EMR team.
And you've been using the system for what, going on almost 4 years now?
Personally, yes. The group has been with eClinicalWorks since 2007.
Very nice. Now, in HealthTexas Medical Group, how many providers and locations do you guys currently have?
We have currently 15 locations across San Antonio, including one of our suburbs, Boerne, Texas.
Okay.
And we've got about 30 providers, about 10 to 15 mid-level providers.
Okay. So you guys have 15 locations, obviously a number of providers. How many patients, what would you say is your patient total?
We see about 1,000 patients a day across the group. There's approximately 50,000 people in our database.
Okay, so really you guys are touching quite a large population portion of San Antonio, as well as some of the outskirts, outside towns. Specialty-wise, you guys focus mainly on primary care?
We are. We're all family physicians or internal medicine specialists.
Big Medicaid population?
Not so much Medicaid, a lot of Medicare. We do a lot of Medicare Advantage patients with United Healthcare.
Okay. And you guys are currently taking advantage of some of the Medicare incentive programs, PQRS, et cetera?
We've done PQRS since it started. We also have completed meaningful use, stage 1.
Very nice.
For 2 attestation periods. And we're getting ready for meaningful use too.
Very nice. When do you plan on attesting for stage 2?
I'm going to be the guinea pig. And so as soon as we upgrade to version 10 at the end of the month, end of March, I'll begin that process, so the second quarter.
Very nice. All right, so again, really we're here to talk a little bit about eClinicalMobile. Thank you for a little bit of background about yourself and the organization that you're working with. Really, what kind of led you to use eClinicalMobile in the first place?
Well, it was the opportunity to have access to our patients' records from wherever we are. We started, it's probably been 3 or 4 years ago, soon after I joined, that we started with the web-based app on our phones and any browser, and it was great to be able to access our messages, access patient records when we're on call in the evening, whenever we needed it.
So obviously you used it back when it was still a web-based application. What would you say the improvement or the changes have been since it's become more of a native app on the iOS?
Much easier to use. Much faster. The menus are very nice. Definitely built for the iPhone.
Absolutely.
It's been a nice change.
No, that's great to hear. The experience has been good. Now, obviously, you guys are a staunch advocate of eClinicalMobile. You work with our development team specifically in terms of beta testing some of the new features. Out of the majority of the features that you've seen so far in eClinicalMobile, what would you say is the most densely used portion of it?
Easily, it's the medical summary.
Okay.
We'll get phone calls at night, or if we're out shopping or out with our families, we get a message, we're able to pull up the patient, know what medications they're on, know who their PCP is. Also important for us is their insurance. That helps guide what we do for the patient or what we're able to do for the patient. And just having that ready access when we need it has been a big improvement.
Now, we talked a little bit previously about the charge capture functionality. Personally, yourself doing rounds, how has that streamlined the process of getting any off-site visits over into your billing department, into your business administration?
It's been much easier for me. In my history as a physician, I've always been bad about doing hospital charges. I hate writing on little cards. So when the opportunity came about to do it electronically, I was real excited about that. So I'll often sit in my car after rounds on a weekend and do all my charges before I go home. And they're all done and sent in. That's been real nice.
Now, on an average day when you go home, do you stereotypically sit in the office until your queue is totally completed, or do you take it on the go?
I try and finish my work before I leave the office. But there's often times when I'm driving home and my staff will send me a telephone encounter that either they missed it late in the day or somebody called right as I was leaving. And I'm able to see that and address it. I'll pull over if I need to take care of that message and get the patient taken care of.
Don't text and drive.
Exactly.
That's important.
Exactly.
Now, do you utilize the e-prescription aspect of it as well?
I do. That's, again, nice on call.
Yep.
Sometimes I forget to send prescriptions in at the end of the visit, and patient will call in the evening. I'm able to access a record, see what I prescribed without any question, and I'm able to send that off to the pharmacy.
I've heard a lot of physicians will actually use that portion of the program more so than they will, or on eClinicalMobile more so than they will on the core application.
Sure, it's pretty nice. And the other time I use that is in the hospital, discharging a patient. It's real easy for a prescription to get lost during the discharge process, so I will send to the pharmacy any prescriptions the patient needs before they go home, so that for the family who's taking them home, they can drop by the pharmacy on the way, pick up the medicine much quicker.
On the topic of charge capture, have you utilized the template aspect of eClinicalMobile and building those out so that you don't have to enter the information every single time?
So I did. When we first got access to eClinicalMobile, I went through and built out templates for the 2 hospital systems that I use. But the process is so easy. It's just as easy for me to enter the charge as new. So I've got them there. They're built. We trained our providers on how to do it. But it's so easy, I don't really make use of it.
Okay, no, that's awesome. Hey, we have templates. You can use them. If it's easier to not use them, that's cool too.
Sure.
Excellent. All right, so we're going to go ahead and take a quick break with a short word from one of our sponsors. Again, we're here with Dr. Michael Dominguez of HealthTexas Medical Group. We'll be back to discuss a little bit more about eClinicalMobile in just a second.
Over the coming year, you will see Helo revolutionize patient engagement by reaching patients where they are with their smart reminders and automated communication. Leading the way is the Helo app, a logical extension of the practice's portal, at no extra charge to you or your patient. 200,000 patients have already downloaded the app. Patients are hungry for better, easier communications with their doctors. Helo will make patient engagement easy and natural for you, marketing your patient while increasing patient compliance and satisfaction. It's so easy to use. No special activation or configuration is necessary on your part. Your patient simply downloads the app and starts accessing the information you share with them via the portal by logging in with the same credentials. Helo can help your patients manage chronic conditions, help them to improve their medication compliance, reach them where they are with the smart reminders and automated communication, and make getting an appointment to see you easier. Help your patients help themselves to online health and wellness with Helo. Find more information at my.eClinicalWorks.com.
Welcome back. This is Aaron Ibrahimi with eClinicalWorks. We're here at the ECW podcast, episode 2, with Dr. Michael Dominguez of HealthTexas Medical Group, talking a little bit about eClinicalMobile. So, Michael, really, what was one of the first things that you decided to use within eClinicalMobile when you first got live with it?
With the app or the
application?
The application.
Yeah.
I made use of the medical history right away. So searching for a patient, on call, bringing up their medical history, knowing who they are, what their medical problems are. I'm able to provide that information to the ER doctor if they're calling. If I'm calling the patient back, I know what happened at their last visit from their encounter history. If it's a call about a medication that wasn't sent in, I'm able to pull that up, see exactly what that was, and send that off to the pharmacy for them.
Okay, so medications, pulling up medical summaries, medical history aspects of the patient's record. Are there any specific features that you can think of where the templating aspect of it, such like the templates within the charge capture feature, would also be benefit, or would be a benefit within the program?
It'd be nice if the telephone encounters
Okay.
had a template associated with them, based on different complaints or call types, to be able to document that, to capture all the information we want captured.
Okay.
That would be helpful.
And that's my product management side. Sorry, it's coming out. Sometimes I get a chance to talk to a physician. I get excited about what else we could do for you.
Sure.
Now, with that said, obviously, eClinicalWorks has always paid attention to its client base. You've had a chance to work with development a little bit on eClinicalMobile. How has that experience been so far?
It's been very good. I was in the beta program for the app, and worked it through, and identified some issues that needed tweaking here, tweaking there, fixed. And development was real responsive to getting those issues addressed.
Very good.
They were able to get it very strong app, as soon as it hit the App Store.
So the feedback has been a relatively quick turnaround
Yes,
time working with
absolutely.
development. That's fantastic to
Very
hear.
good.
How did you actually hear about eClinicalMobile in the first place?
The initial web app, our trainer Diana learned about it, I guess, through our eCW support person, and we implemented it as soon as we could.
Okay.
And then for the app, that came out of the user conference.
Okay.
Damien got my name and contacted me.
Very nice. Now, with that said, you guys obviously had a chance to attend the user conference. Have you guys been doing that the last couple of years, or was it the first time back this year in San Antonio?
I've attended every year since I've been with HealthTexas.
Oh, nice.
So this was my third or fourth.
Okay. And what's the overall feeling about the conference?
Very helpful.
Yeah.
Very helpful. It's nice to meet other users. It's nice to talk with the people who actually build the application and share ideas. The roundtables with Garish have been interesting.
Of course.
It's just a good experience.
Who's your favorite
Well worth
presenter?
it. Probably. No, it's tough to know. They're all good. There haven't been a really weak presentation at all. We've been able to get something out of all of them.
Michael, how many people at HealthTexas are currently using eClinicalMobile?
All the providers have
Every
been
single
trained.
Including your mid-levels?
Mid-levels don't all have iPhones.
Okay.
Those that do, it's enabled for them. They can use the web app. So pretty much everyone. We trained it as soon as I did the beta along with another provider on our EMR team. And so we put it through its paces, talked about the pluses and minuses. And as soon as the app became available, we presented it to all our doctors. The only ones actually who haven't been able to upgrade are those with older iPhones. So that was a good excuse for them to get a new phone.
Everybody likes a new phone. every now and
Exactly.
then. Now, so we've got pretty much every physician really using eClinicalMobile across the board. How do you think productivity has improved since the implementation?
Productivity day to day, probably not so much. Quality of customer service certainly improves because we can respond more effectively when patients call after hours. Improve clinical care because it's not we're not starting with a blank slate when we're seeing a patient. In the hospital, I'm able to pull up the medical summary if it's not my patient, and I've got most of my history and physical ready to go just from eClinicalWorks because I can access that anywhere. One of our hospitals is still on paper documentation, and I'm able to access eClinicalMobile from a computer at the hospital, print their medical summary, and put it in their chart.
So one of the newest features on eClinicalMobile is the ability to actually do a photo capture from your iPhone directly into the patient's chart. Have you had a chance to use that?
We have not yet.
Okay.
We're upgrading to version 10 in about 3 weeks.
All right.
When we saw that at the user conference, that was really exciting. Many of us we'll take pictures of whatever's interesting, pertinent for our patients, and it's a very convoluted process to get it into the chart.
Well, it's often difficult to describe, laceration, a rash,
absolutely.
whatever it may be. So having that ability to just snap a picture of it and make it a part of the chart, which again, as a part of version 10, as you mentioned, the photo is actually integrated directly into the progress note now.
Yep.
So you can see a thumbnail of it directly on the progress note. So that's really been something you guys are looking forward to.
It is. I mean, I've got my phone with me along with my laptop when I'm seeing the patient, and I'll pull out my phone to look up some clinical reference, and it's going to be real easy to just pull up eClinicalMobile and take that picture to help tell the story better.
So we're going to go ahead and take a quick commercial break. We'll be right back with Dr. Michael Dominguez of HealthTexas Medical Group, again, talking a little bit more about eClinicalMobile.
Over the coming year, you will see Helo revolutionize patient engagement by reaching patients where they are with their smart reminders and automated communication. Leading the way is the Helo app, a logical extension of the practice's portal, at no extra charge to you or your patient. 200,000 patients have already downloaded the app. Patients are hungry for better, easier communications with their doctors. Helo will make patient engagement easy and natural for you, marketing your patient while increasing patient compliance and satisfaction. It's so easy to use. No special activation or configuration is necessary on your part. Your patient simply downloads the app and starts accessing the information you share with them via the portal by logging in with the same credentials. Helo can help your patients manage chronic conditions, help them to improve their medication compliance, reach them where they are with the smart reminders and automated communication, and make getting an appointment to see you easier. Help your patients help themselves to online health and wellness with Helo. Find more information at my.eClinicalWorks.com.
All right, so welcome back to the eCW podcast, episode 2. Again, we're here with Dr. Michael Dominguez of HealthTexas Medical Group, talking again a little bit about eClinicalMobile. Dr. Dominguez, tell us a little bit about a situation where you've had to use one of the specific features in eClinicalMobile, the patient search tool.
Patient search comes up every patient every time, just about. We get our calls via our iPhones from our answering service. I pull up eClinicalMobile and put in the patient information, and it's all right there.
Now, has there been a situation where you've had to use the patient input, where you have the ability to create a patient on the fly from your phone?
We don't do that routinely because honestly, we don't trust our doctors to get all the information right all the time. In a pinch, prescribing for somebody with an urgent need, it's a very easy way to do it. You put in the basic information and you're able to document whatever you need.
Okay, and obviously you have a certain level of mandatory fields that can be set up for the sake of patient creation, so
Certainly.
you're at least getting the baseline of information. You're not necessarily collecting all their insurance data that you might need to process claims, but there is the ability to at least require or mandate specific fields when entering a patient.
Yeah.
So, Dr. Dominguez, earlier we spoke a little bit about the way you use notifications from eClinicalMobile on your iPhone. Can you tell us a little bit more about that?
Certainly. I have notifications turned on in eClinicalMobile for messages and telephone encounters. And then I have that email address set as a VIP on my iPhone, so that anytime I receive a notification from eClinicalMobile, it alerts me up front on my iPhone. That's enabled me to respond in a timely manner to those telephone encounters for patients.
Very nice. And that's an important feature that a lot of people who are using eClinicalMobile out there should absolutely be using. It's the ability to kind of specify what aspects of the mobile app really notify you and give you an actual sound notification.
Sure.
Now, since eClinicalWorks has always tried to utilize our forum, eClinical ideas or eCW ideas, are there any specific features within the core application right now that you could see potentially translated or pushed over into the mobile app at some point in the near future?
At this point, they've done, or you all have done, a very good job creating the app to meet our needs. I think the advances in V10 with the photo is going to be huge for folks. Having better access to the laboratory values And if we can get documents, document results, I think that would complete the picture. Because right now, if we have a radiology report that comes through, we can't view that right now.
So are you talking documents in terms of the RAD reports that come back through an interface?
Correct.
Or,
well, we don't have an interface, but they're attached to the
Okay.
radiology order.
Okay.
If we could do that, our providers would be real happy. Because you can imagine the situation if you're leaving the office and you've got a stat X-ray that you're waiting for. It'd be nice to be able to see the report right there from your phone.
Now again, the imaging itself might not translate depending on.
All you need is a report.
Oh, true. The
Yeah.
actual radiologist interpretation.
Yes.
Now you said you don't have any interfaces. I know this is not the baseline of the podcast, but I gotta ask.
We have lab interfaces.
Okay.
We don't have any radiology interfaces
Okay,
yet.
so no PACS.
No,
Okay.
no. We've explored that with one of the two main radiology practices in town. Haven't been able to get too far with it yet.
Gotcha.
It's not that ECW is not ready; it's that
Oh,
their
yeah.
process is.
Well, I'm just saying it does really
challenge.
streamline the process. So as
Yeah.
well as at this point, it might not be something that's come to fruition. It's definitely something worth pursuing in the future to streamline that process.
Certainly.
I know with a lot of clients that I work with, if they didn't have that PACS interface set up, their front office staff wouldn't be able to manage the incoming interpretation as well as the films and attaching everything. Because you do get that both sides of it. You can view your films as well as the interpretation using the interface. And
Yeah,
that's
we
a
need to
huge
talk about
benefit.
that.
All right, so now just one last thing that I wanted to make sure that we get at. Obviously, the biggest thing about eClinicalMobile is having access on the go, having access not only on the go, but in a pinch, in a situation where a patient shows up at 4 o'clock in the morning and the ER doctor doesn't know how to approach treating this patient without a decent baseline medical summary of the patient. So are there any situations that you've recalled where eClinicalMobile has aided in patient care in an urgent situation?
This happens frequently on call or any time after hours. If we get a call on a patient that either isn't our own or we haven't seen in a while, I can be looking at that patient's medical history, their whole chart, by the time they get the doctor on the phone. And it definitely improves the care we deliver because we just know the patient. And all that information is available. I'm able to go through the patient's medication reconciliation and can discuss that with the nurse. Well, what about the metformin they're supposed to be on? And the nurse will say, well, there's nothing, they didn't bring that one. So that raises a flag that I need to address when I see the patient in the hospital.
Of course.
But it's all about the access. It's all about having the information you need when you need it.
We're here to talk a little bit about eClinicalMobile, this time with our product manager, Damian Lee, who's the main person on eClinicalMobile. And again, thank you to Dr. Michael Dominguez from HealthTexas Medical Group, who joined us for the first portion of our podcast to discuss a little bit about how he uses eClinicalMobile in his day-to-day life. So really, we have a couple of questions here from our users, from the actual people out there using the program currently. And they submitted them through a web portal, which we're getting that set up right now. So hopefully toward the end of the show, we'll be able to broadcast that for you guys and allow you to potentially submit some questions for the future. But with that said, let's get down to it. We have a question here from Kim in Minnesota. And she asks, Damian, which features of eClinicalMobile do you consider absolutely indispensable?
Absolutely indispensable. Personally, and I think for most of our users so far, the scheduling aspect is the main and popular feature. For the mere fact that you need to look at your schedule wherever you are. Aside from that, telephone encounters. The ability to just do those when you're home or just away from work makes your life so much more efficient that you can actually address those, again, at your own convenience.
Okay. One of the things Dr. Dominguez had actually said was he sees a lot of value in the patient summary. And obviously that's another thing that I think a lot of people don't really appreciate as much. But it's one of those things where in a pinch, if you absolutely need to know the baseline information about a patient.
Definitely. I think that there are certain occasions when providers are on call, there are ER room situations and so on, where just a mere fact you can look at your patient's home very quickly and access their information, their allergies, their medical histories and so on and so forth do help you at that time.
Excellent. We have another question here from Prasad in Wyoming, and he asked, is it available on Android?
Yes, a couple weeks ago actually we have applied for it on the Google Play Store, and it is actually now there for our users. It has gone over 100 downloads so far, so please do go and download more if necessary.
Wow.
So now we have an Android version, definitely an Apple version, and also, of course, a web version available.
Of course. Another question from Shayna in Rhode Island. She asked, what are the benefits for using the charge capture feature and the rounding list?
The charge capture feature has always been there, for the record. What has been introduced this year is a rounding list for it. The reason why you should like it as a physician is the mere fact that you can now maintain a more easy and available list of people you round for, let's say for more hospital type situations. So providers who do rounds often, I can now have a list as opposed to a paper copy now maintained in my smart device.
Mm-hmm.
At which point, just as easy as clicking on their names and doing charge captures is what it all is afterwards.
So in the past, they would have to actually create the patient in mobile, if they didn't already have them in the
They
system.
have to actually search for them and create a new charge capture every single day, or again every single
So
time
now
you
this
saw
allows
them.
them to kind of just build out that schedule.
Yeah, it's an
ahead of
actual
time.
list for
Okay.
you, and again, it's well maintained. The round list is actually pretty cool too, because so tomorrow, if you were to see the same list of patients, that list again is retained for you. So again, you don't no longer have to add people onto your list; they are there as you keep moving forward. Again, there are visual cues as well to help you out. So, for example, the names turn green for the mere fact that you have finished the charge successfully, and again, it will queue up to your billing team. Visual cues for red, just for the fact you just click save and you have not finished this yet. You just save whatever you've done so far.
Okay. Thank you for that. Jason from Georgia asks, is IMO integration available in assisting ICD search?
Yes, IMO is available. You do need version 10 of the EMR to have it as well. So if you have version 10 of eClinicalWorks, along with, of course, activating IMO on your main EMR, yes, you'll actually see it on your eClinicalMobile for you.
Okay.
In all 3 different versions as well.
And V10 is in the process of being released as we speak. So for those of you guys who don't have it yet, just wait on a little bit longer. It'll be there in a moment. We have another question from Michael in California. How do providers find it to use the e-prescription refill aspect? Have you gotten much positive feedback on that?
Positive feedback as well as essentially no feedback in terms of it just being fine as it is. The provider is easy as looking at your e-Jelly Bean on your main EMR. The same aspect is there. We have a tile just for e-prescriptions for you. Pretty much your prescription come in, and as simple as choosing your pharmacy if you have not already have one, simply fax or e-prescribe afterwards. Pretty much it syncs back to your EMR, and again, with a matter of minutes, goes out to your pharmacy for you.
Okay. We have another question from Samantha in Massachusetts. And she asks, she says, she enjoys using the photo upload feature, likes the idea of it. What experiences with the end users led us to develop that feature?
Samantha, thank you for your comment, first of all. What happens was providers were, if you imagine before eClinicalMobile's photo uptaking ability existed, you'd have to take a photo, presumably from your camera or whatever device you did have, upload to your desktop, and again add locally from your computer into eClinicalWorks. So we've taken all those extra steps for you as an extension of you as a physician. Snap on your phone, and again that actually auto uploads to your progress note, and actually within a matter of seconds. So again, it's there right away when you're documenting in the room.
And it's all
right
secure
now.
process, and it takes away
All
that.
secure. People are worried that will it save a copy on my actual device? No, it doesn't, unless of course you did save it, but it actually just stores a copy on your main eClinicalWorks afterwards.
Excellent. And that's important. A lot of people will be concerned about that, storing
Right.
a temp file and whatnot. We had another question from John in Maine. He's a relatively large practice, and he wants to know, why should he use eClinicalMobile?
For the mere fact, again, just convenience. I think if he's a busy doctor at a big practice, telephone encounters, looking at your schedule, again, on-the-fly type stuff is always good. Looking at your messages, doing your e-prescriptions like we just spoke about is actually key in terms of good features for eClinicalMobile. I assume if John was doing charge captures in a hospital situation, he'd love it for those reasons as well.
All right, and our last question is from Jane in New York. She asks, are there any new exciting features that we should be aware of?
There are a couple being introduced later this year. For phase 2 of eClinicalMobile in terms of, again, the app version, we have e-reply coming. We have users or customers who have mentioned to us that to reply or respond back to their patient portal-enabled users or patients, they weren't able to, so we have introduced that coming in version 2. So when you create a new telephone encounter or, again, respond to one from eClinicalMobile, you can now e-reply. On top of that, we have later this year coming out as well the ability to review progress notes. Eventually, that'll be coming out this year as well. Where
And that'll be helpful for anybody
the
who has
supervising
a
physicians,
yeah
right?
a PA, an NP,
Right. It
a
turns out
residency
that
program.
It turns out for some users, their main supervising providers don't even use the main EMR for these type of scenarios. So to avoid that and to have a use of it from any device whatsoever, we're introducing the ability to review progress notes from eClinicalMobile as well.
That's huge.
Aside from that, we also have PSAC features being enhanced as well. Break the glasses coming as well to eClinicalMobile.
Okay, so if somebody had secured a patient's record so they
Correct.
couldn't see it in the EMR, you'd be able to
Correct.
potentially still get in an emergency situation.
Right.
Excellent. Awesome. All right. Well, again, thank you, Damien, for answering a couple of questions. Anything else you wanted to mention about
Not right now, except please do go and download eClinicalMobile on your iPhones from the iTunes Store and again the Google Play Store as well for Androids. Do check them out. Do provide feedback to me. Love to hear from you guys.
All right. Again, Damien, thank you so much for answering the questions. For Damien Lee, I'm Aaron Ibrahimi, signing off for eCW Podcast Episode 2.
This broadcast and its contents are the sole property of eClinicalWorks and are protected by federal law and international treaties. You are strictly prohibited from making a copy of, modification of, or form of rebroadcasting or re-encoding this broadcast without prior written permission from eClinicalWorks Public Relations, except as may be permitted by law. This broadcast is provided for informational purposes only. It is intended as a personal, non-commercial use. Product specifications are subject to change without notice. Please contact eClinicalWorks Public Relations with any questions. eClinicalWorks V10 EHR is ONC HIT 2014 edition certified as a complete EHR. eClinicalWorks V10 CC 2014 955447-1.